The questions that need to be worked through is how is this integration done? And there are a number of different models. The way that many individuals do it, and indeed we do it in my own hospital, but not completely yet, is that we have a system where actually we attend MDTs and raise palliative care. But we could be even smarter by actually using a slightly more automated system where if people have symptoms, they could self-refer themselves to palliative care, or if people have a flagging system, when people have maybe the cancers that are more at risk of more problems and symptoms. Some people have also said that when phase 1 trials are underway, it should be automatic that people are referred to palliative care, because actually if they're in a phase 1 trial, they are known to have quite high levels of illness, and in a way you're trying out an experimental treatment to see if you can cure them. They're likely to get symptoms. For many, they will unfortunately deteriorate, so actually flagging palliative care in that instance might also be very helpful. And I guess the question is, what do palliative care people do? So in palliative care, we tend to try and look at the person before the disease. So we look at the whole person and put them and their family or those close to them first, and we look at assessing and monitoring symptoms. We look at the decisions that might come up in the future. We look at the whole circumstances, really to try and improve quality of life. Better to let people know about the services that are available earlier rather than waiting until they've encountered lots of problems. And then if somebody knows what's available, they can say, well, actually, I'd really I feel now that I've got these problems, I'd like help. And just even maybe a single discussion with palliative care earlier on, it can actually be very helpful for people. And I suppose the other thing that people often say to me is, well, I don't like to say palliative care to my patients. I'm frightened of saying those words and they think it's going to be the end. So what I would say is modern palliative care is not like that. It used to be that when you said the cancer word, people often thought, well, that's the end, so we mustn't say that word anymore. But in fact, now we know that there are lots of treatments and so on. And I think that modern palliative care is about helping people live well as supporting those when they have progressive illness and when they get worse, and even at the end of life, to try and give a quality of life even then as well as earlier.